If you are a leader or team player within a healthcare organization, a teacher or trainer of healthcare professionals, a next generation healthcare professional or student, a public health professional, a patient representative, patient safety or quality of care professional, a therapist, professional society representative, there's a conference in San Francisco coming up September 12th through the 14th of this year that you should know about. It's called Heart-Based Medicine. And Dr. John Bonhoeffer is an MD and professor of pediatrics at the University Children's Hospital in Basel, Switzerland. He's the co-founder or the founder of the Heart-Based Medicine Foundation. Andrea Gardner is with him. She's a communication specialist, author, and Reiki master. Heartbasedmedicine.org is the website, and Heart-Based MED is the Twitter handle. And Jan, excuse me, or is it Jan? And Andrea, welcome to the program.
Thank you, Tom. Thank you.
Thank you, Tom. Good to be here.
Great to have you both. So please correct my pronunciation if it's Jan or Jan. Dr. Bonhoeffer, tell us about this program.
Thank you, Tom. Well, this program is important and dear to us because the medical system is at a crisis, and everybody knows this. This is a policy issue, and yet kind of hiding beyond and behind policy and politicians is not enough. And we know that the system is in a crisis based on fraud, waste, abuse, and I would add arrogance and greed. Just look at the numbers. Look at depression and suicide being at all-time high in the population. Look at healthcare providers being the profession with the highest suicide rate. Look at medical errors as the third leading cause of death in the U.S. 200,000 people in the U.S. dying. And a lot of this is due to a question of care. It's due to a lack of care, in my opinion. And it's not blaming. It's not that my colleagues and myself are not caring enough. Everybody's doing their level best. But the system is such, and the time constraints are such that really care comes behind knowledge and systems and SOPs and red tape.
Yeah. Andrea, how would you describe heart-based medicine?
Heart-based medicine is a platform for bringing more compassion and more care into healthcare. It's about connection. It's about love. It's about connection. It's about deep listening. We've actually prepared some gifts for your listeners, which tell you how to bring more simple and effective ways into your daily practice and how you can get involved in this culture change.
Into your daily practice if you're a healthcare professional?
If you're a healthcare professional, but we also want to hear from patients. If patients have had experiences within hospital environments, they have stories to tell. We want to hear from them too.
Yeah. Dr. Bonhoeffer, why did you start this foundation, Heart-Based Medicine Foundation?
Well, I worked in public health and worked 20 years in vaccine safety research. And as a pediatrician, I felt that this is probably the most effective way I can save lives and protect the health of our children. And it took me 20 years to realize that we were missing the elephant in the room, and probably the most common, most frequently transmitted disease in humankind today is not any of the diseases that I was aiming to prevent, but it is a virus, if you like, or a transmittable disease that I would call non-love. And it's time that we start to address it. Everybody knows how important love and care, compassion is in healthcare and to being better and to becoming well. This is really common understanding, and it's not part of medical training. And it took me too long to realize this, and so I want to dedicate my next 20 years to this topic.
Yeah. Andrea, I know you're an alternative health practitioner, as it were, or complementary medicine, or whatever they call it there in Europe. These are the words that we use here. And I find it ironic that health care is so often delivered by people operating out of an entirely Cartesian model, viewing the body as a machine, viewing the person as separate from their body, viewing their emotional, psychological, human needs as irrelevant by and large. Just what's the white cell count? Can you speak to that?
Yeah, sure. I have to agree with you. In my practice, it's certainly about compassionate communication as much as anything else, which is part of the prescription, if you like. So we need to move away from that model of, the body as a machine. It's so much more than that.